Did you know that nearly 1 in 5 Canadian seniors could lose access to critical healthcare services in 2026? Or that thousands may be forced to leave their homes due to legal changes they never saw coming? These aren't wild predictions. They're the real consequences of new laws already being rolled out across the country. And yet, most people haven't heard a word about it. This year, a wave of policy shifts is quietly reshaping how seniors live, work, and access care, from reduced home support funding to tightened retirement benefits and confusing digital systems that could lock older Canadians out of essential services. These changes are flying under the radar, and if you're a senior or love someone who is, they could affect your life in ways you never expected. In this video, we're revealing 10 hidden legal changes in 2026 that could devastate Canadian seniors, and what you can do before it's too late.
Number 1. Cuts to federal home care subsidies. For decades, aging in place, staying in the comfort of your own home, has been the gold standard for senior care in Canada. But in 2026, that option is becoming harder to afford. Why? Because the federal government has quietly reduced funding for key home care subsidies, especially for seniors in smaller towns and rural communities. What does this mean in real life? Services that once helped seniors with basic tasks like meal prep, bathing assistance, or medication management are being scaled back. In some provinces, families now face waitlists up to 6 months just to access minimal support. Others are being told they need to pay out of pocket, with costs ranging from $25 to $60 an hour, depending on the region. The most vulnerable are hit the hardest: seniors living alone, those with chronic health issues, and individuals without family nearby to step in. And here's the worst part. Many seniors are being pressured into moving into assisted living facilities, not because they want to, but because they simply can't afford to live safely at home anymore. So what can you do? First, don't wait for the system to fix itself. Start by exploring provincial and municipal support programs. Some local governments have stepped in to fill the federal funding gap. You can also contact community health centers or nonprofit home care services, which may offer sliding scale or subsidized options. And if you're a caregiver, make sure you're registered with any support or tax credit systems still available. Because staying in your home shouldn't be a luxury, it should be your right.
Number 2. Changes to pharmacare eligibility. Imagine walking into your local pharmacy only to find out that the medication you've relied on for years is no longer covered. That's the new reality for many Canadian seniors in 2026. Under recent changes to the National Pharmacare program, several essential drugs have been delisted, and copay amounts have increased, quietly and without much public notice. This shift means that medications once fully covered are now partially funded or not covered at all, depending on your province. Seniors with fixed incomes are suddenly faced with difficult choices: pay for food or pay for pills. For those managing chronic conditions like diabetes, heart disease, or arthritis, these added costs can quickly become overwhelming and dangerous. The most concerning part, many of these changes disproportionately affect low-income seniors and those who fall just above the qualification line for financial assistance. Some are being asked to pay hundreds of dollars per month just to stay on their prescribed treatment plans. Others are skipping doses or abandoning medications entirely, not by choice, but out of necessity. So what can you do? First, don't assume your medication is still covered. Ask your pharmacist for an updated list of what's included in your province's plan and inquire about generic alternatives, which can dramatically lower costs. You can also speak to your doctor about switching to more affordable treatment options without compromising your health. Additionally, look into provincial drug benefit programs like the Ontario Drug Benefit, ODB, or BC Pharmacare. Some still offer partial coverage based on income or medical condition. Nonprofit organizations also sometimes provide help with copay relief or access to sample medications, because no one should ever have to choose between their health and their wallet.
Number 3. Revised CPP adjustment rates. For most Canadian seniors, the Canada Pension Plan, CPP, is more than just a benefit. It's a lifeline. But in 2026, subtle changes to how CPP is adjusted for inflation are beginning to cause major ripple effects for retirees across the country. What seems like a small policy tweak is quietly shrinking the real value of monthly payments, and most seniors don't even realize it's happening. Here's what changed. In previous years, CPP payments were adjusted annually to keep pace with the Consumer Price Index, CPI, basically the rising cost of living. But starting this year, the adjustment formula has been modified, making increases slower and less reflective of real inflation, especially with costs for essentials like housing, food, and utilities rising faster than average. So while your CPP might go up by 1.8%, your rent or grocery bills may have jumped by 5% or more. That's a gap that grows wider each year, slowly eating away at your purchasing power. And because these changes have been quietly implemented, many seniors won't notice until they're struggling to cover basic expenses. What can you do about it? First, if you haven't started collecting CPP yet, consider delaying your payments. Every year you defer, up to age 70, increases your monthly benefit by up to 8.4%, a significant boost over time. If you're already receiving CPP, look into additional sources of income, such as GIS, Guaranteed Income Supplement, provincial benefits, or part-time remote work opportunities. Also, it may be time to revisit your retirement budget. Inflation affects different categories in different ways, so trimming costs in less critical areas might help offset rising expenses. Because your retirement shouldn't be stolen, one small percentage at a time. Number 4. Tighter rules around reverse mortgages. For many Canadian seniors, their home isn't just a place to live, it's their biggest financial asset. That's why reverse mortgages have long been a popular option for older adults looking to tap into their home's equity without selling or downsizing. But in 2026, new federal regulations have made these financial lifelines harder to access, and in some cases, not an option at all. The government's aim was to increase consumer protections, which sounds like good news until you read the fine print. Stricter approval requirements, lower maximum borrowing amounts, and tighter lending criteria now mean fewer seniors qualify. Some lenders have even pulled back entirely from offering reverse mortgage products in certain provinces due to the new compliance burden. The result? Seniors who were counting on their home equity to cover rising medical bills, home care, or daily living costs are being told no, even if they have hundreds of thousands in home value. And those who do qualify are often getting much less than they expected. It's a devastating blow, especially for those without other retirement savings or family support. So what are the alternatives? First, look into home equity lines of credit, HELOCs. They often have lower interest rates and more flexible terms, though approval can still be a hurdle if you're on a fixed income. Some provinces also offer property tax deferral programs, which can help reduce annual expenses for seniors who own their homes. And yes, for some, it may be time to explore downsizing or co-housing options that allow you to free up equity while still maintaining independence. Because after a lifetime of paying into your home, you shouldn't have to fight to access what's already yours. Number 5. Digital ID rollout confusion. In 2026, the Canadian government is accelerating the rollout of digital ID systems, a move intended to streamline access to everything from health records to banking. But for thousands of seniors, this shift is creating more problems than it solves. Instead of making life easier, it's leaving many digitally stranded, unable to access the very services they rely on to survive. While younger Canadians may welcome the convenience, many seniors are finding the new system confusing, intimidating, or simply inaccessible. Signing up often requires a smartphone, high-speed internet, and navigating through multi-step authentication apps, all of which can be overwhelming for those not tech-savvy. One wrong click and you're locked out of your own health portal or pension account. To make matters worse, many institutions are starting to phase out traditional forms of ID and paper-based access, pushing seniors toward mandatory digital participation. This creates an invisible barrier for anyone who isn't digitally fluent, leading to missed medical appointments, delayed payments, and lost independence. So, how can seniors protect themselves? First, don't ignore the transition, it's happening fast. Reach out to local libraries, senior centers, or community colleges that offer free digital literacy classes. Many programs now cater specifically to older adults and include hands on help with setting up and using digital IDs. If you have a trusted family member, consider setting up your account together to avoid mistakes. And always write down login details and security steps in a secure place, not relying on memory alone. Most importantly, don't be afraid to speak up. If a service is becoming inaccessible due to tech changes, file a complaint or request accommodations. Accessibility laws are still in place, and you have a right to equal access, whether online or not. We put a huge amount of effort into researching and creating these videos to keep you informed. So if you found value here, please consider subscribing. It's just one click, but it means the world to us. And let us know in the comments which of these laws shocked you the most and why.
Number 6. Healthcare privatization. Healthcare in Canada has always been a point of national pride, a universal system where everyone gets the care they need, regardless of income. But in 2026, that foundation is beginning to crack. Several provinces, including Ontario and Alberta, have expanded access to private clinics, and while it's being framed as increased choice, the reality for many seniors is far more troubling. Here's what's happening. Certain procedures and diagnostics like MRIs, cataract surgeries, or physiotherapy are now being offered faster through private clinics. But there's a catch. They often come with out-of-pocket fees, and wait times in the public system are growing longer as resources shift away from government-run facilities. Seniors living on fixed incomes may now face a painful choice: wait months in the public system or pay hundreds or even thousands for faster treatment. This shift doesn't just hurt the wallet, it creates a two-tier healthcare system where wealth determines access to timely care. Seniors with chronic conditions or mobility issues are especially at risk, as delayed treatment can quickly lead to serious complications or hospitalizations. So, what can you do? First, be informed. Know exactly which services are covered by your provincial health plan and which ones may incur private charges. Ask for a breakdown before any appointment or referral. You have a right to understand your options. Next, explore community health centers, which often provide services at no cost or reduced rates, even where public hospitals fall short. And if you feel you've been unfairly denied care or pressured into private services, file a complaint with your provincial health ministry. Because in a country like Canada, healthcare should never depend on how much money you have in your pocket. Number 7. Higher taxes on retirement income. Retirement is supposed to be a time to relax and enjoy the rewards of decades of hard work. But in 2026, many Canadian seniors are facing a rude financial awakening. Recent changes to tax laws now mean that more of your retirement income is being taxed, leaving many with less money than expected to cover day-to-day expenses. What changed? In short, the federal government adjusted tax brackets and thresholds for registered retirement income funds, RRIFs, pensions, and investment withdrawals. These changes may seem small on paper, but for seniors on moderate fixed incomes, the impact is real. Some are seeing hundreds to thousands of dollars less per year after taxes, enough to affect their ability to afford housing, food, and medical care. Even more concerning, seniors who save diligently their whole lives are being pushed into higher tax brackets, especially when they withdraw from multiple sources like CPP, OAS, RRIFs, or private pensions. And since many weren't informed about these bracket changes in advance, they're caught off guard when tax season arrives. What can you do? First, it's crucial to get a financial checkup. Meet with a retirement planner or tax advisor who understands the new rules. They can help you strategically withdraw income in a way that minimizes your taxable amount. For example, splitting pension income with a spouse can sometimes lower your overall tax bill. Also, look into non-taxable benefits like the Guaranteed Income Supplement, GIS, and be cautious about when and how you convert RRSPs into RRIFs. Finally, track your income sources and keep receipts for medical expenses, which can qualify for tax credits. Because you've already paid into the system, you shouldn't be taxed into stress in your retirement. Number 8. Reduced support for caregivers. In 2026, many families across Canada are stepping up to care for aging parents, spouses, or relatives, offering time, energy, and even personal finances to support their loved ones. But while caregiving is more vital than ever, the government support for caregivers is shrinking. Key federal tax credits and relief programs have been reduced or restricted, making an already difficult job even harder. Until recently, caregivers could claim non-refundable tax credits or receive modest financial assistance to help offset lost income, home adjustments, or medical supplies. But now, stricter eligibility criteria and reduced funding mean fewer people qualify, and those who do may receive far less than in previous years. In many cases, caregivers are left footing the bill themselves, sacrificing their own retirement savings and emotional well-being. What's more, unpaid caregiving is often invisible. According to recent stats, over 8 million Canadians provide some form of unpaid care, and many are seniors themselves, looking after a spouse with dementia, mobility issues, or chronic illness. Without adequate support, the risk of burnout, depression, and financial strain grows rapidly. So, what can you do? First, don't wait until you're overwhelmed. Reach out to provincial caregiver support networks. Many offer free counseling, respite care, or workshops on managing stress. Next, check with your local municipality to see if they offer any subsidies or in-home support services for caregivers. Also, speak with a financial advisor to see if any of your caregiving expenses qualify for other tax deductions, even if federal credits have been cut. And if you feel alone, remember, you're not. Caregiver groups and advocacy networks are pushing back against these cuts and can help amplify your voice. Because caring for someone else shouldn't come at the cost of losing yourself. Number 9. Housing law reforms. In 2026, Canada's housing crisis has taken a sharp turn, and seniors are among the hardest hit. New housing law reforms aimed at modernizing tenancy and development regulations have weakened rent protections in many provinces. For older adults living in retirement residences, rental apartments, or long-term housing, this means one thing: skyrocketing costs and fewer safeguards against eviction or sudden rent hikes. In places like Ontario, Alberta, and parts of British Columbia, landlords now have more power to raise rents in certain buildings or repurpose senior housing into luxury condos. For seniors who've lived in the same unit for decades, these changes can be devastating. Imagine being 78 years old and told your rent is going up by $400 a month, or that you have 90 days to move out because your building is being renovated. The result? More seniors are being pushed into homelessness or forced to move far from their communities, families, and healthcare providers. Some are ending up on long wait lists for subsidized housing, lists that can stretch 5 to 10 years depending on the region. So, what can you do? First, know your rights. Even with reforms, tenants still have legal protections. Contact your province's tenant advocacy office or legal aid services before signing anything or accepting a rent increase. If your building is being renovated, you may qualify for relocation assistance or have the right to return at the original rate. Second, consider applying early for nonprofit or cooperative housing. Even if you don't need it today, getting on the list now can be a game changer later. And finally, speak up. Local housing boards and city councils need to hear from seniors affected by these reforms, because safe, stable housing shouldn't vanish the moment you retire. Number 10. MAID expansion. In 2026, Canada has expanded its laws around medical assistance in dying, MAID, and while supporters see it as a step toward personal autonomy, others warn it's becoming a slippery slope, especially for vulnerable seniors. With broader eligibility now including individuals with non-terminal conditions, there's growing concern that economic hardship, lack of access to care, and isolation are influencing decisions that should be made without pressure. Here's the reality. Some seniors are now considering MAID not because they want to die, but because they feel they have no other option. Reports have surfaced of individuals applying due to chronic pain, poverty, or the inability to afford proper home care. In some heartbreaking cases, seniors have expressed that they'd rather die than be a burden, a red flag that society is failing its most fragile members. This doesn't mean MAID is inherently wrong, but without strong safeguards and oversight, there's a real danger of it becoming a solution to social problems like inadequate housing, healthcare cuts, and loneliness, issues we should be solving with compassion, not clinical procedures. So, what can you do? First, if you or a loved one is struggling, seek support. There are organizations across Canada offering counseling, peer support, and financial assistance, especially for seniors living with chronic conditions or disabilities. Don't go through it alone. Second, have open, honest conversations about end-of-life planning. It's okay to talk about fears, wishes, and boundaries, but those choices should come from a place of dignity, not desperation. Finally, stay informed. Advocate for proper oversight and support policies that strengthen elder care and mental health access so MAID remains a right, not a last resort. Because no one should feel that dying is easier than asking for help. What we've just uncovered isn't just a list of policy changes. It's a wake-up call. From rising healthcare costs and housing instability to unfair tax burdens and shrinking support systems, Canadian seniors in 2026 are facing a perfect storm of challenges. And the most alarming part, many of these changes were introduced quietly, buried under paperwork, without public debate or headlines. But the impact is anything but silent. It's being felt in homes, hospitals, and hearts across the country. These are not just political issues, they're deeply personal. They affect your independence, your finances, your health, and your dignity. Whether you're a senior yourself, caring for a loved one, or simply concerned about the future, you deserve to know what's happening and what you can do about it. So here's what you can do right now. Like this video if you believe seniors deserve better. Subscribe for more clear, research-backed updates on aging, health, and retirement in Canada. And most importantly, comment below. Tell us which law shocked you the most, or share your own experience. Your voice could help others realize they're not alone. And if you found this helpful, check out our next video, Top 7 Foods That Help Seniors Stay Sharp After 60, packed with practical, life-enhancing tips. Because awareness is power, and together we can make sure these changes don't go unchallenged, and that every Canadian senior gets the respect, care, and protection they've earned.